Good morning. My name is Brianna Anthony. I'm a family medicine doctor in Fort Collins, and I feel very grateful for being invited and everyone who's organized and to be able to share my story. So like I said, I'm a family medicine doctor in Fort Collins. After residency, I was excited to join a successful local practice that was physician-owned. But like many other private practices across the country, they were forced into being bought out by a corporation. I only lasted in corporate medicine for a couple years and left for my mental and physical health. I gave up primary care, at least for now, and started a new private practice, but I don't take insurance. The administrative burden of our insurance system is crushing. It is purposefully complicated so that the rich corporations can make more money. Doctors and other healthcare providers hate their jobs right now because they're not able to take care of patients. Our corporate healthcare is a nightmare. Over the past couple of years, physician burnout has improved from 62% down to 48%. Still an unacceptable level. That's half of our doctors. Just about 80% of physicians are now owned by corporations or private equity, and 10% are owned by one corporation, United Healthcare. This means there's pressure to see more patients, have shorter appointment times, upcode patient visits with the least amount of staff and nursing possible to make more money. That is the focus and not patient care. When healthcare is taken over by private equity and corporations, which is at high rates, the goal is to make employers and the shareholders as much profit as possible. We have a medical system where profit matters more than people. People are getting sicker, some are dying, and costs continue to increase. It's heartbreaking when you're sitting with someone who is just diagnosed with cancer or who lost their job and doesn't know how to pay for their child's asthma inhaler, and you have 15 minutes and 10 more patients to see. Insurance won't cover that medication. The wait to see a specialist is 6 months, and you still have to review all those lab results. Family medicine docs would need 26 hours in a day to give appropriate care to patients at this rate and get the administration and documentation done. Things are missed, care is delayed, patients get sicker, and people are frustrated. This whole experience of what is happening is truly heartbreaking. I made a change to save my mental and physical health so I can continue to work for my patients, not a corporation. Things have to change. We can do better, and we need to do better.